Question number 1. Describe hip joint. The hip joint is the junction where the hip join the leg to the trunk of the body. It is comprised of two bones, thigh bone or femur and pelvis, which is made up of three bones, is called as ilium, ischium and pubis. The ball of the hip joint is made by the femoral head, while the socket formed by the acetabulum. Classification of hip joint. The hip joint is the ball and socket type of synovial joint that connects the pelvic girdle to the lower limb. In this joint, the head of the femur articulates ಅಂತಂದ್ರೆ ಜಾಯಿಂಟ್ ಆಗೋದಕ್ಕೆ ಆರ್ಟಿಕ್ಯುಲೇಟ್ಸ್ ಅಂತಾರೆ ವಿತ್ ದ ಅಸಿಟಬಿಲಮ್. ಅಸಿಟಬಿಲಮ್ ಅಂತಂದ್ರೆ ಈಗ ತೆಗ್ ಟೈಪ್, ರೌಂಡ್ ತೆಗ್ ಟೈಪ್ ಇದ್ದಂಗೆ ಇರ್ತೈತಿ ಬೋನ್ಸ್, ಅದರೊಳಗೆ ಅದಕ್ಕೇನು ಹೇಳ್ತೇವೆ ನಾವು ಅಸಿಟಬಿಲಮ್ ಅಂತೇವೆ. ಆಫ್ ದ ಪೆಲ್ವಿಸ್. ಇಲ್ಲಿ ಡೈಗ್ರಾಮ್ ಒಳಗೂ ನಿಮಗೆ ಗೊತ್ತಾಗ್ತೈತಿ ಅಸಿಟಬಿಲಮ್ ಅಂತಂದ್ರೆ ಯಾವುದು ಅನ್ನೋದು, ನೀವು ಅದನ್ನು ನೋಡಿ ತಿಳ್ಕೊಬೇಕು. ವಾಟ್ ಆರ್ ದ 8 ಫಂಕ್ಷನ್ಸ್ ಆಫ್ bone? The major functions of the bones are body support, facilitation of movement ಅಂತಂದ್ರೆ ಮೂಮೆಂಟ್ ಮಾಡಲಿಕ್ಕೆ, ಎಲ್ಲ ಟೈಪು ಮೂಮೆಂಟ್ ಮಾಡಲಿಕ್ಕೆ ಹೆಲ್ಪ್ ಮಾಡ್ತೈತಿ. ಪ್ರೊಟೆಕ್ಷನ್ ಆಫ್ ಇಂಟರ್ನಲ್ ಆರ್ಗನ್ಸ್, ಸ್ಟೋರೇಜ್ ಆಫ್ ಮಿನರಲ್ಸ್ ಆ್ಯಂಡ್ ಫ್ಯಾಟ್ ಆ್ಯಂಡ್ ಹೆಮಟೋಪಯೋಸಿಸ್. ಟುಗೆದರ್ ದ ಮಸ್ಕ್ಯುಲರ್ ಸಿಸ್ಟಮ್ ಆ್ಯಂಡ್ skeletal system are also known as musculoskeletal system. Here diagram is there. You have to draw the diagram and label it properly. Question number 2. Achalasia cardia. Take away. Achalasia cardia is a chronic condition in which the muscles at the base of throat where food enters the stomach is too tight. This can cause food and liquids to back up in other throat. Cause of achalasia is poorly understood, and researchers suspected it may be caused by a loss of nerve cells in the esophagus. There are theories about what causes this, but viral infection or autoimmune responses have been suspected. Having a creatine genes, having a problem with our immune system that cause it to attack the nerve cells in our esophagus, having perhaps simplex virus or other viral infection, having disease. This is an infection caused by the parasite. Common cause of achalasia cardia. The extra cause of achalasia is poorly understood. Researchers suspected it may be caused by a loss of nerve cells in the esophagus. There are theories about what caused this, but viral infection or autoimmune response has been suspected. Investigation for achalasia cardia. Barium swallowing, X-ray, chest, plain X-ray, monometry, ultrasound, These are the investigations are required. Endoscopic, then myotomy is also required for the. Question number 3. Pneumonia is an infection that affect one or both lungs. It is caused by the air sac or alveoli of the lungs, which will be existed in our lungs, that will be filled up with the fluid or pus. This is due to bacterial infection or viral infection. What is the main cause of the pneumonia? Means here, that is the bacterial cause is the one of the most common cause for pneumonia. Then here there are the two types of pneumonias are there. That is a bacterial pneumonia. That is bacterial pneumonia. Already you know that is the streptococcus. Viral pneumonia means that is responsible for our 1/3 of the pneumonia caused by the mycoplasmic pneumonia or influenza. This is the, and one more is fungal pneumonia. These are the types of pneumonia. Here, stages of pneumonia. There are 4 stages: congestion, red hepatization, gray hepatization, and resolution. These are the types of pneumonia. During the first 3 stages, before feeling better, during the final stage, when the immune cell clear or the infection, this is the stages of pneumonia. Then what are the signs of pneumonia? Means here, that is difficulty in breathing, fever, chest pain, then lips and fingertips color will be bluish discoloration, cough, mucus, severe fatigue, and severe fatigue and getting worse. These are the symptoms of pneumonia. How you are going to diagnose the pneumonia? Chest X-ray, blood test, and CBC count. These then again pulse oximeter. When patient is admitted in the hospital, then you have to put the pulse oximeter. Means during that time also, by observing the oxygen concentration, you can identify maybe this is the pneumonia patient. Okay, like that. Question number 4. Carcinoma thyroid. Carcinoma thyroid means that is the CA thyroid is also same, and malignancy in thyroid, cancer of the thyroid, all same only. The most common type of thyroid cancers are papillary carcinomas and follicular carcinomas, which are known as the differentiated thyroid cancer. They spread much more slowly than other type of cancer. When DTC are diagnosed, means they are usually limited to the thyroid gland itself or nearby the lymph nodes, factors that may increase the risk of thyroid cancer, including female sex thyroid cancers occurs more often in women than in men. Exposure to the high level of radiation and radiation therapy treatment to the head and neck increase the risk of the thyroid cancer. Certain inherited genetic um, syndromes. Thyroid cancer is the more common in women than in men, and more so during their reproductive year. The highest number of women diagnosed with thyroid cancer are between the age of 45 and 49 years. Men are more likely to develop thyroid cancer at an older age. For example, between the age of 80 to 84 years. Thyroid cancer signs and symptoms: a lump in the front of neck near the like apple. Okay, then swollen glands in the neck, difficulty in swallowing, difficulty in breathing, pain in the throat or neck, a cough that persistent and is not caused by cold. Persistent means that is ಕಂಟಿನ್ಯೂಸ್ಲಿ ಹಂಗೆ ಸತತವಾಗಿ ಕೆಮ್ಮುದ ಇರ್ತೈತಿ. ಇದನ್ನು ಡಯಾಗ್ನೋಸ್ ಹೆಂಗೆ ಮಾಡ್ತಾರೆ? ವಾಟ್ ಆರ್ ದ ಡಯಾಗ್ನೋಸಿಸ್ ಲೈಬ್ರರಿ? TSH ಮಾಡ್ತಾರೆ, T3 T4 ಮಾಡ್ತಾರೆ, ಸೀರಮ್ ಥೈರೋಗ್ಲೋಬಿನ್ ಮಾಡ್ತಾರೆ, ಸೀರಮ್ ಥೈರಾಯ್ಡ್ ಮಾಡ್ತಾರೆ, ಆ್ಯಂಟಿಬಾಡೀಸ್ ಮಾಡ್ತಾರೆ, FNA ಮಾಡ್ತಾರೆ, ಟ್ರೂ ಕಟ್ ಬಯಾಪ್ಸಿ ಮಾಡ್ತಾರೆ. ದೆರ್ ಆರ್ ಇಮ್ಯಾಜಿಂಗ್ ಏನೇನು ಮಾಡ್ತಾರೆ ಅಂತಂದ್ರೆ USG ಮಾಡ್ತಾರೆ, CT ಮಾಡ್ತಾರೆ, MRI ಮಾಡ್ತಾರೆ. ಓಕೆ, ದೀಸ್ ಆರ್ ದ diagnosis has done for thyroid. Question number 5. Fibroid uterus. Uterine fibroids are non-cancerous growth of uterus that often appear during the childbearing year, also called, this is the myomas. Uterine fibroids are not associated with an increased risk of uterine cancer and almost never develop into cancer. Type of fibroids. Subserosal fibroids. Subserosal fibroids are located near the outer layer or serosa of the ovacity. Family history of uterine fibroids: high blood pressure, no history of pregnancy, vitamin D deficiency, and food addictive consumption. What are the common symptoms of uterine fibroids? Bleeding between the period, heavy bleeding during your period, sometimes with blood clot. Periods that may last longer than normal. Needing to uterine more often, pelvic cramping or pain with period. Feelings fullness of pressure in our lower belly, pain during intercourse. Then how you are going to diagnose? An abdominal ultrasound, pelvic ultrasound, an endometrial biopsy, then hysteroscopy. Question number 7. Renal calculus. Renal calculus means kidney stones, also called as renal calculi, and hard deposits made up of materials and salt that form inside our kidneys due to diet, excess body weight, or some medical conditions, and certain supplements and medications are among the many cause of kidney stones or renal calculi is risk factors. Factors that increase our risk of developing kidney stones include family or personal history, dehydration, certain diet, obesity, digestive disease, and surgery, and renal calculi. These are the causes. Possible causes including drinking too little water, exercise, excess, exercise, or creating food with too much salt or sugar. Infects and family history might be important in some people. Eating too much fructose and correlates with increasing risk of developing kidney stones, renal calculi. Signs and symptoms: severe pain on their side of our lower back, more vague pain or stomach ache that does not go away, blood in the urine, nausea and vomiting, fever and chills, urine and smell, or looks cloudy. Imaging treats may show kidney stones in our urinary tract. High speed or dual energy computerized tomography may reveal even kidney stones. Some abdominal x-rays are used less frequently because of this kind of imaging test can miss small kidney stones. So what is the name of the surgery means that is nephrolithotripsy and ulceroscopy and open surgery. Okay, these are the name of the surgery for renal calculi. Question number 7. Microscopic features of cirrhosis. Microscopically, with cirrhosis, the regenerative nodules of hepatocytes are surrounded by fibrous connective tissue that bridges between portal tracts. Within these collagenous tissues are scattered lymphocytes as well as proliferation of bile duct. 3 microscopic types, then micronodular, macronodular, and mixed cirrhosis. In the micronodular from regenerating nodules are under 3 mm. In micronodular cirrhosis, the nodules are larger than 3 mm. Number 8. Gastric ulcer. Gastric ulcer, it is also called as stomach ulcer. This ulcer are open source that develop on the line of the stomach. Ulcer can also occur in the part of the intestine just beyond the stomach. These are called as duodenal ulcer. What are the causes for gastric ulcer? The most common cause for ulcer means bacterium and Helicobacter pylori, and long-term use of non-steroidal anti-inflammatory drugs, and Norflox, sodium, stress, and spicy food. These are the causes for gastric ulcer. What are the risk factors of gastric ulcer? Drinking too much of alcohol, regular use of aspirin and ibuprofen, Norflox, and non-steroidal anti-inflammatory drugs, smoking cigarette or chewing tobacco. These are the risk factors of gastric ulcer. What are the signs and symptoms of gastric ulcer? Discomfort between the meals or during night time. Discomfort when person will eat the food or drink the water, means suddenly person will develop the stomach pain, and during night time sometimes awake along with the pain, and bloating and burning and pain in our stomach. These are the symptoms of gastric ulcer. How you are going to diagnose the gastric ulcer? That is taking a medical history and family history, physical examination, blood test, urine test, stool test, and upper gastrointestinal endoscopy and biopsy. These are the diagnosis. Then what is the treatment for gastric ulcer? Gastrectomy, partial gastrectomy and subtotal gastrectomy. These are the treatment for gastric ulcer. Question number 9. Phyllodes tumor. Phyllodes tumors are rare breast tumors that start in the connective tissue of the breast, not the duct. Most phyllodes tumors are benign and only a small number are malignant. Cause of phylloid tumors. We do not know the exact cause of phylloid tumor. They can affect people of any age group, but they are more common in premenopausal women aged between 40 to 50 years. They are also more common in women who have benign breast lumps. Those are called as fibroadenomas. But most women who have fibroadenomas do not develop the phylloid tumors. Then signs and symptoms of phylloid tumors. Causes of phylloid tumors. You may notice hard, smooth, and well-defined lump in your breast. Tumor is usually bigger than 3 cm and may be much bigger. It can grow quickly in matter of weeks if it stretches our skin. The skin over it might appear shiny and transparent or might be in the source. Suggestives of pheloid tumors. Clinically, pheloid tumors tend to present as unilateral, firm, enlarging, painless breast mass that stretch the overlying skin with sticking superficial vein. The size may range from 1 to 45 centimeter and may occupy the entire breast. How you are going to diagnose? That is biopsy and pheloid tumors from fibroadenoma means healthcare provider will identify through the self breast examination. Surgically removal means lymphectomy they will do for pheloid tumors. Question number 10. Nasal polyps. Nasal polyps are vitamin D3 deficiency is correlated with the presence of nasal polyps. Polyps can block our sinus or nasal airway. Nasal polyps are not cancer. They seem to grow due to long-term swelling and inflammation in the nose from allergy, asthma, or any type of infection. No one knows exactly why some people get nasal polyps. Then, ethmoid polyps are the most common type. They develop from the ethmoid sinus. Nasal polyps risk factors. People with respiratory disease such as asthma, chronic rhinosinusitis, aspirin, and respiratory disease have greater chance of having nasal polyps. Then lifestyle risk factors. There is no way to completely prevent nasal polyps of any size from forming, so no significant lifestyle adjustment will be make a major difference. They only potentially help keep them away is the best. Using nasal spray, using antihistaminics, getting allergy shots as need as possible. This could potentially help prevent the formation of allergy polyps that can block our airway. Nasal polyps investigations. CT scan, doctor pinpoint physical examination and images, X-ray and elevation of extent of swelling or irritation due to inflammation. Nasal polyps surgery means endoscopy surgery. Nasal polyps surgery is lower than for general sinus surgery, that is polypectomy. If the polyps are in the nasal passage, our ENT will be perform the polypectomy. Question number 11. Vitamin D deficiency. Vitamin D deficiency means you don't have enough vitamin D in your body. It's primarily cause tissues with other bones and muscles. Vitamin D is an essential vitamin that our body uses for normal bone growth and development and maintenance of our body. Vitamin D also play a very important role in our nervous system, musculoskeletal system and immune system. The most common serious complications of vitamin D deficiency means then low blood calcium level, that is called as hypocalcemia. Low blood phosphate level means hypophosphatemia. Rickets means softness of the bone during childhood. Then osteomalacia means that is softness of the bone in adult. Then vitamin D, how you can able to prevent, then what type of care you supposed to take. Vitamin D test is not approved, but vitamin D is necessary for routine preventable screening due to insufficient evidence of efficiency. Vitamin D test is proved and immediately necessary for some of the medical conditions and medical diagnosis also we associated with vitamin D. Vitamin D risk factors of vitamin D means already you know that is hypercalcemia, hypophosphatemia, rickets and osteomalacia. Okay. Question number 12. Causes of cardiomegaly. Cardiomegaly means an enlargement of the heart. Can be caused by damage of the heart muscles or any condition that makes the heart pump harder, usually including pregnancy. Sometimes the heart gets large and become weak for unknown reason. This condition is called as idiopathy, cardiomyopathy. What are the causes for cardiomegaly? The causes of cardiomegaly are, that is, understand and many causes. You supposed to understand, you have to change your lifestyle. This is lifestyle related risk factors, including tobacco using. There are many forms of tobaccos are there that you can understood. Okay. High cholesterol and high blood pressure and diabetic. These are the causes for cardiomegaly. Okay, high cholesterol means then lipid profile. Then during the time when you will do the lipid profile test, during the time you can understand this is a high cholesterol, low cholesterol, HDL, LDL. What is the report is there, you can understand. Question number 13. Primary complex. Primary complex is formed, consists of granuloma, typically in the middle or lower zone of the lungs. In between the lungs, that is granuloma, growth and development will takes place. In combination with transient hilar or lymphadenopathy and some overlying pleural reactions. Then these means that is the primary complex. What are the causes of primary complex? Tobacco chewing gum is usually, and inhalation of infected particles, or maybe in the which bacillus will be passes into the lungs. That is damage usually. Lungs will be damaged usually due to this infected bacillus will entering into your lungs. Then some of the always confined to one segment with concurrent involvement of draining frequently hilar lymph nodes. This gives rise to the primary complex means that is the granuloma. The primary complex consists of the combination of cutaneous reactions at the site or inoculation with tuberculosis bacilli. Then tuberculosis bacilli is the one of the inoculation. Okay, tuberculosis free individual plugs the involvement of regional lymph nodes. Then which is the this tuberculosis bacilli will be involvement in the which are the lymph nodes are existed in our body. Question number 14. Osteosarcoma. Osteo means it is related to bone. Osteocarcinoma is the non-cancerous benign tumor that develops during the childhood or in adolescent, is an abnormal growth that forms on the surface of the bone near the growth plate. Growth plates are areas of developing cartilaginous tissue near the end of the long bone in children. In causes of, that is the causes of osteosarcoma. Osteosarcoma is the one of the unknown cause, and but tumor is cancerous. It is related to abnormality in the growth plate, cause the bony prominence to grow away from the factors of osteosarcoma. Then common risk factors of osteosarcoma. This will be development in the previous trauma to the growth plate, means small age, any accident, falling history, that is the one of the risk factors. Exposure of previous radiation, ಯಾರಾದರೂ ರೇಡಿಯೇಷನ್ ಥೆರಪಿ ತೊಗೊಂಡಿದ್ರೆ ಪ್ರೀವಿಯಸ್ಲಿ ಅದು ಒಂದು. ಓಕೆ, ದೆನ್ ಕಂಜಾನೆಂಟಲ್ ಲಿಮ್ಸ್. ಕಂಜಾನೆಂಟಲ್ ಮೀನ್ಸ್ ಬೈ ಬರ್ತ್ ಅವ್ರಿಗೆ ಏನಾಗಿರ್ತತಿ ಅದು ಡಿಫಾರ್ಮಿಟಿ ಇರ್ತದೆ. ದ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ osteosarcoma is during the age between 10 to 30 years, especially during the teen age. Growth and development will be occurs especially in osteosarcoma. This is between the rapid bone growth and development in the at the age of in teen age, and sometimes this risk will be goes down in the middle age also, but rises again in older adult also. Older adult means then usually over the 60 years. Question number 15. Types of necrosis. Pathophysiologically, then liquefaction necrosis, then coagulative necrosis, and casus necrosis, fat necrosis, fibrinonecrosis, and gangrenous. These are the types of necrosis. Necrosis are having the stages. Necrosis stages of vascular necrosis can be divided into 4 main categories: pre-collapse and early collapse, late collapse, and arthritis. Pre-collapse stage means this stage is characterized by minimal to no symptoms, and the bone damage can only be detected through imaging tests such as MRI and X-ray. Necrosis is the death of body tissue. It occurs when too little blood flow to the tissue. This can be from injury, radiation, or chemicals. Necrosis cannot be revised when large area of tissue die due to the lack of blood supply.